Good evening. We're here for a workshop tonight, and we are going to start with the community collaboration update. I believe Catherine, Jesse. Do we want to do that first?
Why not?
All right, we'll do the pledge first. You guys, you're already standing. Let's do it. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right.
Good evening. I'm Catherine Ryder, Executive Director at Tri-County Mental Health Services, and I am also the project lead for our collaborative community recovery project. And here with me this evening are Jesse Michaud, our clinical director at the agency, and I think you probably all know Officer Philippon, who is an active member of our steering committee. So we will be jointly presenting to you this evening. And I thought I would start, actually, let me open this, by quickly refreshing your memory about who the stakeholder committee is comprised by. And there are multiple staff from Tri-County Mental Health Services, 2 staff from St. Mary's Regional Medical Center, 2 staff from Central Maine Healthcare, Professor Boss from Bates College, Androscoggin Home Care and Hospice is represented, Community Concepts, CEO, Lewiston Police Department, Auburn Police Department, Androscoggin Sheriff's Department, and the Androscoggin Jail Administrator, the Maine Alliance for Addiction Recovery, Healthy Androscoggin, United Ambulance, and we have added consumer voice over the past year as well, meaning that we have people with lived experience in their own recovery process who sit there to inform us as we move through the project. So we're going to go back and forth in terms of who's going to speak to each of these items, but these are updates from the last time we were here, so they're additional elements of the grant that we're working on. And we're going to start with ODMAP, actually the Community Opiate Overdose Response, which is, and it's a project that is governed by Quality Counts. I don't know if any of you are familiar with Quality Counts, but it is a state program that is focused on health care improvement and identifying outcomes to measure what we're doing within the healthcare field. And there's a significant amount of grant dollars from the federal government that have come into Quality Counts, and so they've engaged us along with several other providers across the state. You can see there are 12 local communities across Maine, and I'll show you where they're located in just a moment. And they're using a technology platform. So ECHO is actually televideo that brings these providers together. So you can be sitting here in Lewiston and you can have the 11 other stakeholders across the state actively involved, and we're all in a learning modality. So we're learning from presentation from faculty, and then we're also doing case presentations that are related to overdose deaths from opiates across the state of Maine. And the other sites, as you can see, are Portland, Bangor, Lewiston, Boothbay, Brunswick, Passamaquoddy Tribal Nation, Augusta, Knox County, Farmington, Sanford, Lincoln, York County, and I think I started with Portland. And then there's a faculty hub that comes from both the state of Maine and outside of the state of Maine.
So one of the other spin-off projects from the original steering committee is a program called ODMAP, and it's a federal program. So any community can enter into ODMAP. It's free. It's typically been used by law enforcement and EMS to input data around overdoses in a community. And the nice thing about this is that you can see on a map where the overdoses have occurred, when they occurred, basic demographics of the person, but not a whole lot of information. You can also track overdoses. So if we were to find out in Lewiston that a lot of the opiates being overdosed on were coming from Massachusetts, we could see a spike in overdoses in Massachusetts and know that there would be a potential spike in our area as well. So we could beef up law enforcement and also recovery coaches and other community advocates in the area to know that there could potentially be an increase in overdoses.
And one of the great things about this is it will give us hard data as we move forward to apply for additional grants and or to present data to the state.
There are 2 levels.
Can I ask how you get that information? Is it through police and hospitals that comes to you, or is it from those reports themselves?
So ODMAP has 2 levels. So most EMS and police are using it as level 1. So they're entering the data. So they're inputting the data in real time, or as close to real time as possible.
Oh, it's
and
on the
then-
next slide,
yeah,
I'm
that's
told.
okay.
I'm so sorry.
And then level 2, which is what, so for instance, Tri-County Mental Health Services has a level 2 access where we're able to see the data, but we wouldn't necessarily be entering data into that database. So we can track trends across the country dependent on if folks are using it. So I believe the only state that's currently using it statewide is Maryland.
Correct. And
Thanks
one of
for
the
the
other
review.
benefits of this is that it eliminates duplication, and that has been a concern for some period of time as to who's entering the data and is it duplicative. So this is something that we are just beginning to venture into. This is Safe Needle Exchange, and Maine General Hospital has been doing this for a number of years, and they have been doing it well. We knew that it was something that we wanted to consider as part of our project, but we wanted to make sure we had our feet underneath us and a strong collaborative of providers working together. So there is a cadre of our steering committee that will be heading up to Maine General on Thursday of this week. They will be sharing with us their policies and procedures, sharing with us their practice and outcomes over the past few years. We will bring that back to our community and hope to implement that at some point over the next several months. And the question that remains to be answered is, will there be any funding for this initiative? I'm aware that a year ago there was a bill on the floor of the House for $75,000 that would have provided clean needles for the entire state of Maine. And I know that this is a very controversial issue, and it's one that I struggled to wrap my head around for a period of time, but I can tell you that when we look at the research and we look at the rising rates of sexually transmitted diseases, HIV, AIDS, hepatitis, and when we consider that there are pregnant women who are injecting with needles who not only may deliver a baby who has an opiate use disorder, but may have some other compromised medical condition as well, we really feel that if we can do harm reduction and provide folks with clean needles, and while we're doing that, do some coaching around accessing of services and getting them engaged, that it could be a win-win. Joe, you're up.
Good evening. So Project Support You is an initiative that the police department started actively at the beginning of September this year. It's been in the works now for a couple of years now. But back about 13 years ago, over a decade ago, the Lewiston Police Department used to have a state-funded position from DHS, I believe, who was a crisis worker. The state lost, eliminated funding for that, so in turn we lost our crisis worker that we used to have. So initially, this project was about putting a crisis worker back in the police cars with us, responding to calls and being able to be right there in the heat of the moment to help us resolve a situation. But as we were organizing that program, we realized that it would also be adaptable for our overdose responses. So the ultimate goal of Project Support You is two-pronged. One is for us to do direct follow-up within 24 hours to anybody who's overdosed within the community, to offer them support, to see if we can help get them into services. Also, the goal is that if we have any mental health calls come in that our patrol divisions are struggling to find some type of resolution, that we can also show up directly, have contact with that individual and assess the situation directly with a crisis worker. And then the second prong of this is an actual ride-along component, like what we had over a decade ago, in which we'll have that same worker in the cruisers who can respond to mental health calls, to substance abuse or overdose-related calls, and again, be there, right there in the heat of the moment, with fresh eyes to try and offer support.
So another piece of this project is also training staff and community members to deliver Narcan in the case that someone has overdosed. So we're in the process of working with United Ambulance to provide some of our staff at our 1155 Lewiston Street office with the Narcan training, so that if someone were to have an overdose event in our building, or while we were out in the fields, we would be able to deliver that to that person. We also have recently installed AEDs, automated external defibrillators, in our building, so that if someone were to have a cardiac event, we would have that available to them much quicker than sometimes response, depending on our location for EMS. So we will be having a training to look at both of those things and using them very quickly in tandem so that we wouldn't withhold treatment if someone were having a cardiac event and not necessarily an overdose. Sometimes we have folks that walk into our building that we don't necessarily have a lot of background information on. So if someone were to collapse in our waiting room, we may be able to do both and not necessarily know what the cause of them going down would be. So.
And I can share with you that there's a commitment from our steering committee members to likewise train their staff to be able to administer Narcan as needed as well. There are other federal funds that we recently learned were available to us, and those come through a program called CORE, and I wish I could tell you what that acronym stands for, but I can't remember it off the top of my head. The good news is that Quality Counts made this connection for us, and it will provide a number of trainings for folks in our community to include an MAT waiver training for prescribers, so medical doctors who wish, or nurse practitioners who wish to be able to prescribe Suboxone. And so that training will come local on-site at no charge, and we have a pending training coming up in December. We waivered 9 new providers in this community back in February. Unfortunately, we picked a date when both hospitals were implementing new electronic medical records, and we had a large fall off from the initial registration. This program is also going to provide evidence-based practice training for clinicians who will be working with individuals with opiate use disorder. And those are very expensive for organizations to pay out of their own pocket. And so having them provide those trainings will be critically important. Recovery coach training, one of which we've just recently completed, and we have someone in the room here with us tonight who went through that program who has spoken very highly of it. We have a second training coming in December. And then they're also offering to bring folks that are actively in the field and have been, I don't know if any of you are familiar with the term hub and spoke model, but it is one of the models that the state of Maine has funded to the tune of $6+ million in the past legislative session, and we're waiting for those funds to come down. We've been actively studying and preparing for that model here in the community, and folks who are doing that work in other states will come to Maine to speak directly with our providers to talk about their learning and their experiences and what the potential potholes that we may fall in along the way would look like, so hopefully we can avoid those. Low barrier housing was one of the pieces that I presented to you last time I was here, and that was the discussion about how do we shelter people, even if they are still actively in use, so that we can get them stable and move them towards treatment. For anyone who may be familiar with Maslow's hierarchy of needs, it states clearly that until basic needs are met, we're not able to move folks beyond that, and treatment certainly requires function at a level where if you're not sheltered and fed, you're probably not going to be able to participate well. So we've been having conversations with folks at Avesta and Preble Street. It's very early, but we believe that there is some potential for them to look at development within the communities with support from the councils. We've also had a presentation to the chamber, and from that, some individuals who've asked for our clinical person to come out to their respective organizations, because this certainly has an impact on the workplace, and we believe as well that we need our workforce here in Maine to look at the potential for hiring individuals who have felony charges, because if you have been convicted and you have a felony charge and you have been incarcerated and you come back out into the community and you are unable to access meaningful employment, the likelihood of success and recovery will be limited. And so finding folks, and we have had a couple of very successful conversations with local employers who have nodded their willingness to look at that opportunity.
Another piece that we're implementing is we have folks from the Maine Family Planning coming and being co-located at our Tri-County offices throughout the month at our different locations and offering low-cost or no-cost family planning to clients that come into our offices already. So they're able to receive services with us and also with Maine Family Planning, so they don't have to go to a second location that they may or may not feel comfortable going to. So we're hoping that folks that come into our services, we can sort of guide them to be able to use the Maine Family Planning services as well while they're in our building, and reduce, again, unintended pregnancies, the spread of other diseases that are spread through use of needles or unprotected sex, and also to have those conversations about awareness and the other resources that we have available to those clients.
So I know that was fast and furious, but it was an update, and we are happy to take any questions or hear any concerns that you may have.
So I'll start off, I guess. You know, we hear a lot about opioids, and I think, unfortunately, it's become kind of a politicized issue. And some people come out and say, we are not doing anything about this opioid crisis, which I think obviously is quite ridiculous, because you guys are working very hard on this issue. One of the narratives I find somewhat troubling is, and Joe, you might be able to help us with this, we have people say all we're doing is arresting our way out of this problem. And I want some good common sense perspective on that, and if you, Joe or Catherine or Jesse, could provide some of that, that'd be really nice to hear, because we hear that a lot. We're only arresting our way out of this, and to me that's completely ludicrous. But
Well, I would just say that I think this is truly a carrot and stick model. We are arresting, we are finding, identifying our drug dealers, we are seeking charges. We have a number of officers that are solely focused to drug interdiction enforcement, but we also have trained all our officers to carry Narcan. We have a prescription take-back box in our lobby. Also, we have a box on the wall to collect needles. In addition to that, you know, our partnership with community, and again, our Project Support You initiative to follow up. So I think we're pretty balanced here locally, and one, trying to keep people that come in here taking advantage of our people who suffer from substance abuse disorder, and we're also doing our best to try and provide an avenue for recovery for those who do suffer from substance abuse disorder.
And I would just add, first of all, kudos to our law enforcement officers, because if you were to ask me who the most consistent attenders at the steering committee are, it's law enforcement. And they are the best social workers we have. They're grassroots social workers, and they want to do the right thing. It's been challenging because there hasn't been a wealth of funding for treatment and prevention, and I suspect that as we move forward and these federal funds start to come through, and you know, the awareness grows and the funds for the hub and spoke model are released, that's going to change going forward. I think we've all been cobbling things together to the best of our ability, and as a community, I dare say that this community is one of the strongest in terms of working together across organizations, and we've seen tremendous commitment. So I would suggest that over the course of the next 6 months to a year, things will be significantly improved. We have a universal release training coming up at the end of this month that will allow all of our steering committees to share private health information for the folks that we're working with across all of our organizations, so that we can bring all the resources that we have to bear on each individual that we enroll within this initiative. That is unprecedented, and so we are very excited about the potential for really being able to resource people with everything they need and not just a piece of what they need.
nice. And I want to thank you for not providing us with a list of demands at the end of your presentation. That was really nice.
I can do that now.
Okay, yeah, here it comes. But just for us up here, is there anything as elected officials locally that we could be doing more to help you, assist you, and make this happen?
You know, so just the changing of the stigma that's associated with this. People have a serious illness that they need to recover from, and we are rolling out some supports that, if the world around us will embrace that, we can move folks through a process and into recovery. And that's not to say we're going to be 100% successful, but we believe that we have the ability to change the face of this opiate crisis. And the other thing that will be critically important is the low barrier housing that I mentioned earlier. If we can't shelter people, if we can't get them off the streets, then we're probably not going to be able to start them on that process to recovery. And so when we come back around with the professionals who have the resources and the experience to implement low barrier housing, I hope you will listen to what they have to say.
Okay. Councilor Lyson?
Thank you. First of all, thank you for your work, and I echo the mayor. Sometimes we hear that nothing's being done, and I talk to a lot of people who are in treatment or who are still abusing or whatever, and to me, this crisis, though, is a crisis, and it seems like nothing can move fast enough to address the needs that we have. But I'm just had a couple questions as well. The steering committee itself. I mean, I'm a strong believer that the work we do that's important needs to be informed by the people who are most affected by it. And you mentioned a little bit about people who may have had histories in that, but are there subcommittee, I guess you call it, members who are have experience with opioid addiction and treatment and such?
Thank you, great question. So Consumer Voice is actually at the steering committee, and then we have a subcommittee called the Recovery Community. And that is comprised of individuals, different generations, different genders, who come to the table on a monthly basis and help us to decide in which direction we're going to go. And it's very interesting how the generational difference rears its head in that meeting, because they have different language that they use for what we call an opiate use disorder today. Some folks still refer to as addiction. And so we're meandering our way down the road, because even people in recovery don't necessarily all speak the same language.
Because, and I don't know who's involved with that, but we had recently had a presentation, and it kind of led into this update as well, is young people in recovery that you're familiar with, and recovery connections and whatever. And I think they could play a role to help. And, at first we were talking about maybe a new committee or whatever, but I don't think that's really necessary. But I would like to see that. It seems like it's a subcommittee of the subcommittee, right? Some people have got some great experience in it, individual as well. And when they came, there was we also talked about the recovery residences, and I think that's where the council is going to play a role, because there needs to be some interpretation on some of the zoning issues that we have with respect to those houses. And so I think the sooner the better there. I mean, I think I know Code is looking at those issues now, because there's been applications and whatever, but I do totally agree with you that people need to be in a safe situation in order to really even seek treatment and begin that process. If they're living where they're surrounded by the temptations of addiction, it's not going to work, and as you know. So the other thing is, I wonder what work that you've talked about doing it in the jails, or maybe you can explain that a little bit, because I think that's where we have an opportunity to do some interventions and stuff, but doesn't often happen. So
Right. And what I would say to you is, so the Andrews Garden County Jail Administrator is a member of the steering committee, and Sheriff Sampson is as well, and he's also a board member of the agency. Our conversation for a long time has been, there is no funding for us to do that work in the jail, but the goal is to use recovery coaches. And so we've just trained a cadre of those folks, and now we just need to figure out how do we move them into that environment in a way that is safe and appropriate, and what would the work be, and how would we oversee that work and support them, because it's challenging work. But we have a couple of folks that have expressed that specific interest.
because I mean, these things seem to be necessary to be done like last week, you know what I mean, or a year. The best time to plant that tree is today, though. So I just encourage you to kind of look into that as well. Another comment I wanted to make is that I think we have another great opportunity for funding, and that's through Medicaid expansion here in Maine.
Absolutely.
I know a number of states, including New Hampshire, said this is going to give us some of the resources. If people have access to a primary care doctor, then they can get the referrals necessary and go through the process of being referred. And I think that's, we've lost a big opportunity there to really deal with, to have these resources. And I think we all this is what we'd like to do if we had the resources. So, but again, I think, and I appreciate the research on grants, because I think it's, we're obviously not a rich community, but we've got issues that are everywhere in the United States these days, especially urban areas. So, but I think that Lewiston, sometimes it's like let's put our heads together to figure out how we're going to pay for this. We got to do it. So, and this is the kind of issue I think we do. And when people are dying every day, it's, to me, this is like, you know, collaboration's great, we've got to do it, but we've got to do some things, we've got to have some boots on the ground. Obviously, the police are. We can talk about, and Chief O'Malley, I think there's a police-assisted addiction and recovery initiative that's being presented at Harvard, December 6th and 7th. As I understand it, you may have some of the police going. You may not know about it either. So, but I think that's, you were talking, I don't know if you guys are aware of that at all, but it's Police-Assisted Addiction and Recovery Initiative at Harvard, 6th and 7th of December. So you might want to look into that, because I think bringing back, and it sounds like you're trying to bring the experts, but this is one specifically that is for the police. And obviously, first responders, be it police or fire or whatever, I think need that kind of training. And like you said, the idea of a crisis worker traveling with them or whatever, if possible, that's terrific as well. I mean, I'm more concerned with people accessing the treatment that they need to do. And I know Narcan's another controversial item, but one of the things that really struck my heart when I talk to people who have gone through addiction, it's like, tomorrow's the day I'm kicking the addiction. Tomorrow. It's always like, this is what I really want to do, because I don't like this. And if they die, they never get that chance. So I think it's you know, again, this addiction's a little bit different because it includes, suburban housewives are addicted to opioids because of prescription drugs. So it's not, I think we have a better understanding that this isn't a part of a social subset of people who are bad and weak or whatever. And I also think that talking the narrative that's going around, and you said the anti-stigma stuff is really critically important. I think when young people in recovery presented, that was their big thing, is that we need to stop talking about this in the kind of language of abuse and whatever, and it's really illness that people have. So again, thank you for your work. What I can do to help facilitate moving forward more quickly and maybe broadening some of that with some people who really have some good information as well. So thank you so much.
So just to respond to your concerns very quickly, because I know we're probably running down on time. The steering committee was set up as part of the MEHAF grant, and so that stays static, but the subcommittees are open. So if you are aware of people who are interested in participating, they are welcome to join us. And I have ongoing conversations with people that are not part of the committee structure on a regular basis, because they're doing work in the community that crosses over with the work we're doing. So we want to collaborate with them. We don't want to be exclusive. Secondly, we are providing services. We're cobbling those together in the best way we can until we have a more fluid process and a pathway that keeps all of us working together in the way that we hope we will be within a year or so. And then, what was the last piece? Sorry, darn it. I forgot the last piece. I should have written it down. It'll come back to me.
Thank you.
I'll outreach you, Jim, when I remember.
Councilor Ray.
Thank you. I want to echo the gratitude for coming back and following up, and I assume we'll stay in close concert. A couple of questions I did have. Is there involvement with the school systems at all? I realize this is probably more of a regional effort than just Lewiston, but could you possibly speak to that if there is any?
I would say not directly, although I was recently at a conversation that took place around the attributes of a new superintendent and had an opportunity to review with the school system then the work that we were doing with this project. I think certainly we've done community forums. We held one at Lewiston Middle School. We had another Franco's Center, and then we're planning another at the Auburn High School, where we're placing ourselves in areas where we believe students and parents would best hear the message, even though it's open to the community at large.
Okay, that's great. Thank you.
Well, also, one of the committee members is Healthy Androscoggin, who is doing an awareness campaign at the high school currently about Juul and others, things like that they're experiencing more there within the student population. So.
Okay, that's great. And then the second question was, I know we talked, it was talked about a little bit about Narcan training? Yes, sorry. And what about distribution in the community? I know that's come up in a couple of different conversations from Young People in Recovery, and there's another organization. Is that something that you all are working within as well as part of your scope?
I don't see us as distributing it, not us personally. There may be other folks that will do that. Our goal was to get all of our committee members, organizational staff, some percentage of that staff trained and able to administer within their respective organizations. In terms of folks in the community, I don't know that that's our specific goal, but there may be others who will take that piece on, and that's where I think the collaboration with other people who are active in this issue will come into play.
Okay, and would you envision them becoming involved through the subcommittees that are open at this point, or?
Possibly. I mean, as I said, I have conversations on an ongoing basis with people who are doing this work. They're not necessarily attending the committee meetings, either because it doesn't fit into their schedule or because the work that we're doing is on different ends of the spectrum, but nonetheless, we're in communication.
Okay, great. I think that was it, but let me double check. All set. Thank you so much.
Thank you very much.
Thank you.
Guess we can start without Jim for a minute, but Superintendent Webster is up.
Good evening, Mayor Bouchard and City Councilors. Thank you for having us tonight. The purpose of tonight's meeting is to provide you information, answer any questions you have on requests, which we hope will come before the City Council next week. I'm Bill Webster, as you know, Superintendent of Schools, and I'm here with Jody Doobie, who is a art teacher at the high school, as well as Francis Gagnon, who is Chair of the Visual and Performing Arts Committee. I'm going to add a little more information to the memo that was in your packet, and then I'd like to turn it over to Jody and then Francis to fill in more information that I think you'll find helpful. The paving project that was ultimately done at Lewiston High School cost about $370,000. It added 45 spots. And through the combination of two LCIPs, there was $400,000 allocated to that. And you may recall that we had hoped to do even much more, but paving bids were just outrageous this year, and they're probably going to continue for a little bit. So there's approximately $30,000 left in that account. And when we looked at the direction we wanted to go, it seemed that spending an additional $25,000 now for the architect might actually save us more than that amount in the long term if we get good costing information, and if, and there are a lot of ifs, school committee, city council, voters did want to proceed with this project, you know, building costs that continue to escalate, and this is something that's been on the back burner since 1974, and we'd like to move forward. So with that, let me turn it over to Mr. Doobie.
Good evening. First of all, thank you for your service on the City Council. As a taxpaying citizen, I appreciate it. I'm wearing a couple of hats, I suppose, as a taxpayer, as well as a teacher in the art department and a content leader in visual performing arts at Lewiston High School. This is a unique opportunity, and one I hope doesn't slide by. For quite some time, we've been discussing the need for an expansion of the school for the visual performing arts. And what we hope to accomplish with the money that would go to the architect, it's been very carefully and thoughtfully designed so that it not merely takes care of the visual performing arts needs, but the high school itself, if you're familiar with, I mean, it's been since 1974, the school has changed, our needs have changed. The billing is incredibly tight, and we have a lot of teachers teaching off of carts in various content areas. And if we were to try to do this, we would try to maximize the benefit for our taxpayers, maximize the investment. Not only would we like to expand the visual performing arts teaching area, we'd also like to have the second floor as an expansion of the high school. And we've been discussing plans now for a couple of years, it seems, and a plan that was set in place last year involved a center that was 2 stories and addressed merely the visual performing arts. And things have been tweaked a little bit, where now the visual performing arts are on the first floor together as a community, which the teachers very much appreciate in the design. And the second floor would be an addition to the high school, a much needed addition to the high school. And the cost estimates put the current plan that we're aiming at about the same as the initial plan we were talking last year. So part of our discussions has very much involved responsibility in terms of the monies we're using and spending for the taxpayer. This is a unique opportunity. As I said, I don't know. 18 years ago when I began teaching at Lewiston High School, we put together a plan to build an expansion, which was much needed then for the visual performing arts. And at the time, there were a lot more pressing issues around the district with various elementary schools, and a number of those have been addressed beautifully and continue to be. And we believe now is time. And in asking for this reallocation of money, there are a lot of various people in this committee who share various viewpoints, so we've tried to come up with the most intelligent plan we can that's responsible in terms fiscally and what the school needs, what our students need.
So I'm Francis Gagnon, as you heard, I'm the chair to the Visual and Performing Arts Committee. Should I adjust it? Is that better? Thank you. So I'm Francis Gagnon, chair to the Visual and Performing Arts Committee, as well as the chair to the school committee and ward rep to Ward 3. And I might just add that a welcome invitation to contact me or anybody on our school committee, which are in attendance this evening, as well as Principal Anglis back there, to visit the high school. Give us a call. We'd be glad to set that up and give you a tour of what is known as the arts department, or
The dungeon.
the dungeon, the basement. I mean, some rooms, actually most of the art rooms don't even have windows, and it's hard to imagine an arts department like that. And it's also difficult to express to students who come from the middle school to the high school, and the difficulty they have in finding the arts department. I might add as well, you may have already seen a video that I helped record with Mackenzie Richards about a year ago, I would imagine. And it was basically, it started at the entrance of the school, and it went all the way to the one of the art classrooms. And we did it from a perspective of someone with a disability. So we took the elevator, we took the ramps, and so forth. And luckily, the elevator, as soon as we pushed the button, it was there. And there was no equipment from the kitchen, because that's initially what it was built for. It was built for the maintenance staff and for the kitchen to move their supplies. But in this case, we used it for someone with a disability. And when you got to the maintenance area, you had to cut through a classroom if you had a disability, because you can't go through the stairwell. And so the only way to get to the off-ramps, or the on-ramps, however you want to look at it, is to cut through an actual ongoing classroom and to get to the art wing. By the time you get to the art wing, someone with no disabilities was still late to class. So it's quite the challenge. It's a maze. And what we're trying to do here is to reintroduce an arts wing to the community that was cut many years ago for whatever reason, to be under budget, to finish on time. We understand that. But this would be a new face to the high school. It would be right near the entrance. It would be welcoming to our community, to parents, but most importantly our students, and how that would reflect to our community. So again, I'll just end it with saying, feel free to contact any one of us. We'll be glad to give you an actual tour it's pretty surprising. And kudos to our staff that's been teaching the arts to our students over the years, but it's time that we actually give them some kudos and make them unified together as well as for our community.
And just to add a couple more things, if the request is granted, I would anticipate that we would come back to you in a workshop type format to report on the results of that work, because you're obviously going to need more information before anything on an LCIP would be considered. And then secondly, and I don't know whether you're taking public comment tonight, there may be one or two people in the audience who would like to comment as well. Thank you.
Council?
Mr. Mayor,
Councilor Bean?
I wanted to reiterate what you said about getting to the art department and the art classrooms, because I substituted at the high school a few years ago, and I'm sure it's the same thing because they were in the same place, right, down in the dungeon. And I walked down the stairs, but I used the elevator to go up the stairs, and it's really, truly unbelievable. You have to go through a music classroom that is in full session and just kind of walk along quietly. I also worked in special ed and used, I took special ed students through that classroom too, and here we are tromping through the room. And when, the teachers and the students were wonderful, but it's really not a very good way to teach our children. It's just too hard to get to. But I have to tell you, the artwork and the music that came out of that dungeon were unbelievable. And if they can do that in a classroom, for instance, an art classroom without windows, and it was really dark even with the lighting. I can't even imagine what they could do with a wonderful art room that's light and free, and of course same thing with the music room. It was next to the cafeteria and next to a loading dock. I think it probably still is, right? They were wonderful. Even with a substitute, they would get to work and do their work, and it was just wonderful and beautiful. So I I agree with you, it's time. And it appears that the money has already been allocated, and we're not asking for new money, or is that what? Even if you're asking for new money, it's okay with me, but I just wanted to clear that up.
I think it's fair to say that if we weren't here for this request, then that roughly $30,000 left over would not be spent. We would ultimately want to come back, whether through future LCIP or a new budgetary expenditure. But given that we have this need now, we have identified possible use of these funds, we hope the council will support the reallocation.
Yeah, I certainly do, and I hope the rest of the council can support it, because I think it is time that we have a better situation for the students who want to study art and music. And probably, I don't know if there are other things involved there.
May I comment to that? I mean, there are a number of students who, it's a valid content area that students choose to take because they want to study it, major in art and major in music after high school. But I think for the vast majority of the kids that come through our program, and it's an incredibly popular program, we have a lot of students. It's a really important experiential thing, I think, where students are given a chance to do problem solving and creative pursuit. Those are all some of the soft skills and things that I think a lot of local business people look for in their employees. And I think we provide a unique situation for students to have that kind of experience. And just one more thing, not to be flippant, the dungeon is one of the nicer expressions we get. We also get the bowels, which I don't care for.
Thank you.
Thank you.
Councilor Bengill?
So just a couple questions. To reiterate Counselor Beams, this is money already on the table. We're just reallocating it, correct? Yeah. And actually, is it Mr. Obi? Doobie, sorry. I just wanted to say it pleased me very much to hear you talk about how the arts and music lead to critical thinking skills in our students, and how much of a need that is in the world. So thank you for recognizing that in our students. Kind of some general questions. This is all about the students, correct? Yeah. Classrooms, they're just walls and floors and ceilings. If making art is a priority, why have we not moved those classrooms? Now, if there's kilns or anything like that, I get it. But if it's art or photography or painting, drawing, anything like that, we can move those classrooms. That's putting that at a precedence. When I graduated Lewiston High School in 2002, there was talk about why is there not a performing arts center that was in the blueprints. You know, as Chair Gagnon said, it was dropped for whatever reason, whatever it may be. But that's literally a lifetime ago. We're not putting a priority on this because, again, we can move those classrooms. Other classrooms can get shifted around. My wife was a teacher, and she taught out of those carts at the middle school, having to huff the roll cart up to the third floor every single day, day in and day out. The other thing too is it sounds like this started out as just a visual performing arts center, and now that's been cut in half to add classrooms to the high school, which again takes priority away from this project. If that's the case, I can't support this because we're not making those kids a priority, and we're not giving any value to the community. So if we're going to do a visual performing arts center, let's do a visual performing arts center and just do that. So thank you.
So if I may, just a few comments, and Principal Langley's is in the audience, so he could address the first point you made as well. There are no empty classrooms at all at Lewiston High School. Right now, the one saving grace where they are is all our art teachers are in the same general area as the department. There's no place in the building that we could move them, and I think that to a person, any class that would move down to the lower level would feel that it is inadequate space and not appropriate for students. In terms of the size, I think there's some on the Visual Performing Arts Committee that felt that the first plan, while wonderful, represented, well, in fact, represented the absolute best that we could provide. But that maybe a very good plan that also considered other needs at the high school might be better perceived by residents of Lewiston. We have, for example, in the basement of the high school is our special ed department. And these are services that, for the most part, didn't exist when the school was built. We need to get them out of the basement too, in my opinion. But there's no place in the main floor or the upper floors in order to do that.
If I could real quick with that, I understand that. But you just said the students in the basement deserve better than that. So why don't we give them better than that? And I'm not saying that there's not empty classrooms. I've been in there as a student, and then recently for events there was Kids Day America that I was in there, and I've seen the changes with that. But you can still physically move a classroom, and I think that would benefit the students to that. And saying that we need to reallocate funds from a performing arts center to better benefit the needs of the school system as a whole, it's a disservice to the city, it's a disservice to our students, and it comes down to a fundamental problem wherever that exists of respecting our students. My daughter currently attends Geiger Elementary School. She's in the 2nd or 3rd grade. She's going to kill me, but it is what it is. We attended the meeting for the new superintendent search that was held Tuesday night, Monday night, whichever it was, the 29th in the evening. My daughter stood up and spoke. No prompting from me, my wife, anything like that. And she talked about the issues she has as a student in the school. I was super proud of her. You know, just 8-year-old girl standing up speaking to a room that was 20, 30 people in there. Nobody she knew. The report that came out last week, I think, from them listed all the adults that were in attendance and 2 students. They felt that my 2 kids being there and speaking was worthy of recognition to that. My daughter had homework. She needed to read 15 minutes of a book. My daughter reads at least 45 minutes on a daily basis. There's times I have to say, put the book down. We got to eat supper, or you got to take a shower. It's time to go to bed. Go and put the book down. I wrote a note to her teacher, said, hey, she attended the superintendent search and actually spoke in front of all these people. And this has been something that's been going on the whole school year since September. Her teacher looked at her and said, make sure you read 30 minutes tomorrow. And this is a girl who regularly submits stuff that says, read 30 minutes today, read 45 minutes today, on a regular basis. That's civic engagement. We need more of that in our young people, the ability to stand up and speak their mind and get engaged in these processes. And the school didn't respect that. So I said, you know what? Fine. 30 minutes on everything. I don't even record what she does anymore because the teacher just has to say, you know what? Turned in, rubber stamp it, doesn't matter. It's respect for our students, and it's not happening. And that's gotta change. And I'm not saying that that's you. I don't know where it comes from. It's a big organization. I get it. But it's still a rot in our school system.
I hope that you'll express that to your daughter's teacher, because I certainly agree with you in your interpretation.
Thank you.
May I also just briefly speak to something that you said earlier?
Yeah.
About this amended plan as some sort of step down or less than what our students deserve. What really that plan involves was taking out a space that was questionable insofar as it would probably end up getting carved up into classroom spaces anyway, and bringing what is a partial 2nd floor downstairs so the department could be together. It really sacrifices little to nothing of what the first plan did. It was actually probably a more responsible alignment or design of the department. It provides for, you know, soundproofing and practice rooms and a lot of things that music folks don't have now, MIDI and storage in all of the art classrooms. And we now have a digital art teacher now with that program. This is the first year of that program, and it's booming already. It creates a community of the department, which all the instructors are very much in favor of on the first floor. And, you know, in some of our discussions, you know, we've talked about the possibility of just building a single-story addition for the fine arts. And as pragmatists, we also, when we think about the bigger picture, this would be a rare. I don't know when we can come back and ask for money for an addition to the school for the tight quarters we have for all of our content. But we thought about the wisdom, and we talked to the architects about how much would you have to spend to like add a floor to, and it's just not thinkable. If we were to build something to create a 2-story addition, financially it's probably more responsible at this point than trying to do it at a later date. So where the additional content or the other classrooms on the 2nd floor came in was that when things were consolidated somewhat, that created some room to think about and to talk with other people and maybe expand and double the bang that you get for the buck. So it's not really a step down from the original plan in that sense.
Mr. Wright?
Hang on one second, Jillian. What was the vote on the school committee?
The vote was 6-3.
Okay. The other thing I'll ask, We have some larger classes coming up through the elementary school. What would we be moving downstairs to fill those classrooms as those larger classes come in? Or is the upstairs of this Performing Arts Center going to absorb everything we've got coming? I mean, do we have a plan for that? I know Longley could be in the long-range plan for some programming, but are we just going to take the performing arts out of the dungeon and put someone else down there?
I think that some of that space could well end up at additional LRTC programming, because it is in that same general area. We also would need to do some renovations, and particularly ventilation work for that. I also think that we need a place for our maintenance staff. And so I think it could be more district offices, perhaps, for things like maintenance, technology. Those are all possibilities.
Have we looked at the opportunity potentially with an empty Longley school next year to possibly do visual and performing arts there and do the much needed renovations downstairs at the high school?
So we are, it will be in the budget, the proposed budget, that we Longley become an expansion of the high school, an alternative programs that we already have. One's at the Armory and one is presently at Tree Street for 1 year. There's, it would require extensive renovations to, for example, to have there's no large room at Longley where you could have a band or a chorus, for example. There's not a kiln. And I think more importantly is the program we're thinking about for Longley would have, while there potentially could be interaction between students at Longley and students at the high school, by and large, they're going to be independent organizations or independent programs. And so, given the number of students that take one or more art classes, to have to come from the high school to Longley, I don't think would be practical.
Just want to make sure you looked at it.
Yeah, okay.
Councilor Bean?
Thank you. I just want to reiterate what the superintendent said and what Mr. Doobie said. You can't, it would be very difficult to move a band room to another classroom in the building, because the band room is loud. And they need special equipment like pianos and things like that, and either they would be disturbing other people or other people would be disturbing them. And I agree that those rooms downstairs are not appropriate, I don't think, for any students. I think maybe an expansion of the LRTC would be a good idea, but I think there have to be renovations and things done to it. I think those rooms would need some renovating too before you put other students or other people in there. They're really pretty bad. It's been a lot of years since you've been there, and they haven't gotten any better.
I mean, you can still move an art class. It's specialty classrooms like music where you need soundproofing, you know, art, pottery, things like that. I get that. But you can move an art class. You know, you can probably move a photography class. Digital arts, that's a computer lab.
Yeah.
So I did notice we had some school committee members here, and Jake is here. So if Jake or any of the school committee members have anything to add one way or another?
There may also be a community member.
There may, okay. Of course, Tina.
So I'm Tina Hutchinson, and I represent Ward 7 on the school committee. I'm also a member of the Visual and Performing Arts Committee. You cannot take a math class and move it down in the basement and move an art class upstairs, for a couple of reasons. Your art teachers want to stay together. They work together as a team. Your math teachers work together as a team. So to change classes around doesn't solve the issue. The issue is all these bigger classes are coming up to our school now. We have no other place to put the kids. We have more and more teachers every year on carts. We have teachers doing their work in the hallway to prepare for a class because their classrooms are being used for someone else's class. It's time for us to act. And I was one of the 3 negative votes. And I'll tell you why. Because I'm tired of having to come to this council and saying we need to reallocate money to meet the needs of our kids. Our kids' needs are not being met now, and they need to be. So I think the whole 30,000 should go, not just 25.
Thank you, Tina.
Robert Reed, Chair of the Lewiston Finance Committee and member of the Visual and Performing Arts. I was asked to be on the committee. It wasn't the one I originally wanted to be on, but Mr. Webster asked, and I said, sure. Originally, this group of people got together to talk about a Visual and Performing Arts center and classrooms. Grand visions, 2,000-person auditorium, scaled to 1,500, scaled to 1,000, scaled to 750. Still looking, $30 million just for the Performing Arts Center. We've come to the realization as a committee that that's just not something that Lewiston taxpayers can afford. This is a project that will get no state funding, and we have no large benefactors who will cover this for us. So we said, what's the best thing that we can do now for our students to help them? And Jody Doobie was one of the people most instrumental in coming up with a different design plan from what the architects came with that really looked at what's the best use of space by creating this wing, a new wing to the high school. So he looked at the first floor. We've had discussions. As a group, we all agreed that putting a second floor on made sense, if only from the standpoint of the cost of materials and construction are going up exponentially. You've seen it with the fire stations. The new substations are going to get more and more expensive each year you wait. The same with the high school. Steel, masonry are getting very expensive right now. So we thought, if you put a second floor on, what do you use it for? What's the best use to help the kids? There have been discussions on alternative ed, on ROTC, and on language arts, for example. Nothing is set in stone in what goes in that space other than if you're going to build an addition for the arts to help those students, now is probably the time to just build the second floor and be ready so that you can move everything out of the basement and give everyone at the high school a better shot, so that teachers aren't rolling carts all the time to get to class, so that kids have an easier time. And frankly, for the public coming in, the new entrance and a gallery area to showcase the art is something that's pretty amazing for our kids that they don't have now. I hope you'll consider, I think, you know, we see it all the time on the Finance Committee. We move money around. Sometimes things are added to a project or there's something happens and we have to change it. It's pretty straightforward. We need to pay the architects to come up with a realistic cost to do a realistic project. And I'm just hoping you'll support that. So thank you.
I'm Jake Langlis, principal of Lewiston High School. Wholeheartedly support this effort. I think the students would benefit a great deal, and I'll just stay up here if you have any questions that you want to ask me directly. But I would.
Guess you're off the hook tonight.
Good evening. As most of you know, I'm Bruce Damon. I'm chair of the planning board. I've been working with the school committee at Mr. Webster's request almost since the day he started with us. I've been involved with the new elementary school and on this visual and performing arts committee, which I found to be, you know, this is so long overdue for the kids. I had three of my kids went through the high school. And the art program was all, and the music and chorus were always what really helped our kids become, you know, so much more rounded. To the point that my middle daughter is now the entire art department at Monmouth Academy. She went to Farmington, and then she went to USM, and she has her degrees in art, and basically because of what she got in the dungeon. How much more could she have done had she had better space, and the teachers would have been more rewarded for their work by having that space? Hard to tell, but they've done amazing stuff with limited opportunity, limited resources, to say the least. You know, we built the high school in '74. It hasn't been added onto. How many businesses or how many facilities have been able to stay with just what they had from, you know, nearly 50 years ago? Most everybody that looks at it knows that it is overcrowded. The space where the band played, when my kids were in band, was ridiculous. I mean, it was a bunker down in the basement, and I guess it made it so that you couldn't hear it upstairs, but they all thrived on that whole experience. And that's what's really important about this. This new space that we're proposing, and this is why we need the money transferred for the architects to finish the plan, has gallery space, has welcoming space, that when you enter the high school, you're going to be able to see the fruits of what those kids and those teachers have been able to produce. There is no gallery space now in the dungeon. Most people that go to the high school could never find it if they looked for it. So this is an opportunity for us to allow the architects to produce real plans, get real solid budgets, move this process forward in a timely fashion so that we could bring this potentially to a referendum vote during the 2019 November election, when we would really be able to get full citizen participation and recognition of just what it is. So moving this money now is going to allow us to get this done in a timely fashion. And I would hope that you could all support the fact that we need to do something, and we need to do it now. Thank you.
Thank you, Bruce. Anyone else?
Luke Jensen, Ward 5 School Committee, also on the Visual Performing Arts Building Committee. Just one thing I think we left out was that there are security enhancements as part of the plan. So there will be increased security at the high school as a result of the enhancements done. So didn't want that to not be mentioned. Thanks.
Thank you, Luke. Okay. Thank you very much.
Could I,
Councilor?
on a related note, and I talked to Jody about this, and I think everybody's got an invitation, but there is an art opening tomorrow at the Lewiston Middle School from 4 to 6. And it's the Dia de los Muertos Shrine Project. And this is 8th graders who have created over 100 shrines memorializing their loved ones who have died. And this is a project that's been going on, I think it's its 8th year. But this year, the presentations will be, they're now on display in the middle school, again, in a hallway. Again, 4 to 6 tomorrow at Lewiston Middle School, and the public is invited as well. Most of you have probably got an invitation, but I don't know if Superintendent, if you did or not, if you're part of the management team. But Jody, I know you didn't, so thank you.
I'm embarrassed to say I was in the dark. Sorry.
Thank you.
Thank you, Commissioner.
And just for everybody's benefit, this, an item, resolve will be on next Tuesday's agenda to authorize the reallocation.
Great. Thank you very much.
Thank you very much.
Thank you for your time. Thank you.
Thank you to the school committee for coming out on Tuesday. Okay. We are up to the airport. Reallocation of funds.
Mr. Mayor, Rick's here, the director of the airport, for technical equipment questions. I'm here from the financial side of things.
Understood. Turn it over to Heather.
Right. As part of the FY19 budget deliberations, the airport put a $300,000 tractor in the budget. The city of Lewiston funded our portion, the $150,000, as part of our fund balance allocation. The actual acquisition cost came in at $239,000, producing $61,000 surplus. At the airport committee's last meeting, the airport director discussed acquiring 2 additional pieces of equipment to assist with the snow removal. One is a V-shaped plow that has an estimated cost of about $6,000. The other is essentially a sidewalk plow. Unfortunately, since I wrote the memo, the actual bids came in. The lowest bidder at this point is $46,000 for the sidewalk plow. So of the $61,000, we would be requesting $52,000 be transferred to purchase those 2 pieces of equipment, which would still provide a $9,000 surplus to turn back to fund balance.
Our fund balance or the airport's?
Our fund balance.
And that would be completely out of our side, or is that Auburn need to approve this also?
Auburn would be approving, going through the same exercise as well.
Okay. Questions from the council? Councilor Ray?
Sorry, when you say sidewalk plow, it's the compact tractor, correct?
That's correct.
So 6,046. Thank you.
Council? Councilor Pettengill?
So the memo made note of staffing issues. And while I see the need to do it, especially after talking with people that use the airport, I'm curious that after we spend $52,000 to buy these pieces of equipment, who's going to use them to do the snow removal?
Rick, you can jump in anytime, but the staffing, this equipment provides for more efficient ways to move and remove snow at this juncture with the same staffing. Right now, we just don't have the pieces of equipment to make efficient snow removal.
So there won't be not a lack of use, but there'll just be more man hours essentially to spent doing snow removal with the new equipment.
I equate it to using a shovel to clear around City Hall versus a snow blower.
Right. Okay. Thank you.
Okay.
Anyone else on the council?
Again, there'll be an item on the agenda next Tuesday to reallocate those funds.
Okay. And now, Misty Parker.
Good evening, Misty Parker, Economic Development Manager, and I'm here before you tonight to discuss a potential grant opportunity. The John T. Gorman Foundation has invited the city to apply for a $125,000 grant to assist with our Choice Neighborhood Early Action activities. And what that means essentially is through our planning process so far, we've identified some preliminary needs within the neighborhood that there could be opportunities to begin some of the work to do improvements within the neighborhood. One, to demonstrate to the community that as they provide feedback and involvement in this planning process, that yes, we are hearing them and that what they are informing us can be realized. Also through that, it's an opportunity to address some of the leading issues that are easily identified and easily resolved. So with the funding, we would be looking to do improvements to adding street trees. That was identified early on. We hear from a lot of residents the need for more trees in the neighborhood. Working with Public Works, it's not easy based on the layout of the neighborhood's current infrastructure to just add street trees, but we've identified some areas where we feel with some additional work with property owners this spring, we could do a concentration of street trees to show the community that we have heard their requests for more trees and have involvement in ensuring those trees get planted and well taken care of. We also have identified through our latest round of pop-up forums where we are sharing the data collected so far, just census data or administrative data that's available with the community, and also seeking input from residents about their thoughts on what types of improvements could be addressing some of the challenges there. Overwhelmingly, we heard that from residents that lighting was a issue within the neighborhood that they felt, if improved, could improve safety within the neighborhood, especially in areas that they currently didn't feel very safe in the evening times. So through this funding, we'd be looking at two potential opportunities. One would be improved lighting and festive lighting within Kennedy Park as a fun way to add additional lighting in that area that has been highlighted as one of the areas that people are concerned with in the dark. And we would also, we don't think that we can get it in time for the holiday season as we had originally planned based on some limited electrical access within the inside of the park, but we're trying to figure out what could be addressed around the park and then with additional work, improvements inside the park. We also, our Healthy Neighborhoods neighborhood development team, who has been assisting as with the planning work, has been looking at potential opportunities to do some of this early action work, and one of the projects that they would be exploring more is developing a porch light project, and could be available for building owners to provide some additional lighting that would not be, a direct floodlight, but would provide some additional ambient light that could reach the fronts of the buildings and sidewalk. So to enhance some of those darker areas where streetlights alone aren't providing enough lighting to make residents feel safe. And so there's several communities that have explored these types of programs and found them very successful. So some of the work that we do ahead of us would be investigating how could we put locally a program like that together here. Lastly, the funding we would be looking to use to enhance some of our strategies and action items coming up later would be a smart infrastructure strategy. The city has a variety of different components for smart infrastructure that they've already started utilizing within Public Works. The most recent is the change from to LED lighting, streetlights. With that new type of lighting, there are components that can be added on in the future to do a wide variety of different things, whether that's providing broadband services or having better control over the lighting to increase the lighting as a response to calls for service in that area. There's also gunshot detections, things like that that can be utilized with this technology. However, at the moment, we don't have the staff capacity within City Hall to really fully understand the capabilities of this type of smart infrastructure, how best it could be used within the city, and what we should be thinking about long term. So some of the funding would be made available to contract a consultant that is experienced with this type of smart infrastructure to develop a strategy for the downtown neighborhood for what we could be thinking about and doing to incorporate these types of technology long term into the neighborhood and really get the full benefit of this potential. Additionally, if the city was able to leverage an additional $20,000 towards that, the strategy could be evolved into a whole city-wide. So taking really most of the funding to use at the neighborhood level, but making sure that it rolls over into a full city-wide strategy. So we're making the best use of the opportunity and thinking long-term about what the benefits and how this could be used within the city as a whole. We'd be focusing on three main areas: public health, digital equity, and public safety. Those seem to be the leading components of where we could be focusing that attention. Are there any questions?
Councilor Pettingill.
Couple questions. For the street trees that we're planting, who's maintaining them?
So it would be, if it was within the city right of way, it would be the Public Works Department. If it is on private property, we would have a maintenance agreement with the property owner, one, to give permission, and two, to ensure that they are being maintained.
Okay.
And as I understand it, it's in line with past programs the city has had in partnerships with private property owners to plant trees. So.
Councilor Ray?
My question is similar. In terms of the lighting work that might be done, is there a partnership already identified with Public Works?
Excuse me?
Is there a partnership already identified with Public Works for any potential lighting projects?
Absolutely. We've been working with them on trying to develop a budget and identify what those opportunities could be specifically to Kennedy Park. And so we're working on what possibly could happen within the next few months, as well as trying to think long-term about it too.
Okay. And just clarifying, this memo says 125,000 and our agenda says 100,000, which is correct.
The $125,000 is correct. As we identified with Public Works some electrical infrastructure concerns within the park, we are able to increase our request just to make sure that we have the funding needed if we need to do some upgrades that we weren't originally anticipating.
And final thing, I just want to say as a participant in those pop-up forums, I thank you for hosting them, and I see some folks who were critical in those in the audience too, so thank you for that. And I love the idea of being responsive to that feedback that you got. I think a lot of times feedback goes into the ether and then we don't really respond to it. So I'm really pleased to hear this coming like closed loop.
Councilor Marcotte?
Just a curious note, the $40,000 reference for a smart infrastructure strategy, is that coming from the 125 or is that in addition to the 125?
Yes, the $40,000 would be coming from the grant, and that would be targeted at the downtown. If the city wanted to leverage that opportunity and have that strategy address the citywide, we would be looking for an additional $20,000 from the city to do that.
Okay, and let me just toss in a little bit more information there. We're investing about $1 million in going to LED streetlights, and we just spent $160,000 for the first phase of our smart water meter system. The capabilities of those systems can be significant. They can be designed and expanded over time to do, I mean, you start with a simple thing like the streetlights can report themselves as burned out, not working. Then you can go beyond that to things like, as was mentioned, gunshot detection. You can include air quality monitoring. You can include the ability to transmit video. So if we wanted to add additional video cameras, you can include things like traffic counting. It's potential we could use a system like that for continuing our efforts to interconnect our traffic signals and potentially even go further with them in terms of real time as opposed to what we have now. The difficulty that we have is we have some choices to make about how to go forward. One option is to go forward using the smart meter system as a backbone, which basically is a more centralized system where everything reports into a receiver at a tower, or you can go with a more decentralized system. None of us understand this stuff enough, and it's fairly new in the world, to know what the correct decision is and what the best strategy would be going forward, but I think there's endless possibilities here. And when I suggested to Heather, if we could find another $20,000, even Heather agreed it was probably worth the investment. And if I can pass the Heather test, I think I'm doing pretty good. So I just, urge you to consider that because I think it's a terrific opportunity, and our best option is to try to make decisions today that don't foreclose options in the future.
Councilor Lewiston?
Yeah, and I like the fact that, this is a grant and that they've been very involved in our community for a while, and it's nice to be invited to participate in these types of grants. I'm not a big believer that lighting makes places safer. I think it's people who, but if the people don't want to come out because it's dark, I can buy it. But also a porch light program and the fact that lights in the park that could be more festive, but also provide that friendly invitation to be in a place that's not dark and shadowy. So I think it's a great opportunity for us. I'm fully supportive. I want to learn more about smart infrastructure and what it can be. Ed's kind of piqued my interest there. It's something even new for me as a planner, so interested in seeing what we can do. And I think knowing the J.T. Gorman Foundation there, and some of the work that the Healthy Neighborhood people are doing and others, that we're researching some of the best practices, and it's exciting that we can take advantage of some money to help us do that too. So, hey, hallelujah.
Council Marco?
Ed, can you remind me the meters? What was the dollar value you stated?
I think the first phase of the meter project is $160,000, and that included installing the central receiver at the Weber Tower and the first round of radios to be installed on the meters.
And so 85,000 of the 125 would be required to do everything else that you've stated in the memo? There's no available funds in the 125 for that 20?
No, the funder is focused on assisting the downtown choice neighborhood plan, but they were okay with us expanding if we had additional funds spanning the scope of that project.
Okay, and when you say plan, are there tangibles, or is that just a consultant report?
Excuse me?
The 85,000, you said downtown plan.
The choice neighborhood transformation plan that we're currently working on. So, yes, there are tangible strategies that are evolving out of the plan, and what this $85,000 would be used for is some of those early strategies of specific physical improvements that would be physical improvements that would be recommended as part of the plan, just doing them now as the plan's being developed.
Okay, and the smart infrastructure strategy would be a document?
It would be a document, yes, and that would be incorporated into recommendations for action activities to come out of the plan, as well as a document that the city could use in general for future planning purposes.
I would support expanding it, with the additional 20,000.
Councilor Pettingill?
Has the city looked into any of the smart city challenges that are out there? A lot of the larger companies are trying to push municipalities to do this. Like IBM has the Smarter City Challenge. I know Cisco has some. Have we looked into any of those yet?
Not yet. When this was first brought up, the opportunity to be thinking about what types of smart infrastructure could be improved in the neighborhood and utilized, it was new to many of us, and so we started to research it and try to get an understanding of just the capabilities in general, and that's when we realized that just having a larger understanding of what this type of technology can do and help us wrap our heads around it was really the next first step. But yes, there are lots of things that could be accessed through that.
Yeah, because the one that I'm most familiar with is the IBM challenge, and they actually have a team of people that come in and do data crunching and then help the city analyze that data on top of a nice cash prize, I guess, on top of that. Because while I understand the benefit to doing this work in the downtown, there are other areas of the city that could most utilize this, which I understand that you know. And then the other thing too, the lights that are self-reporting and all the stuff, if they're out, I'm assuming that's going out on Wi-Fi? Or how is that being reported?
Well, it depends on the system you go with.
Yeah.
If we went with the smart meter system, that might be a radio-based system. I believe most of the traffic light or most of the street light-based systems are Wi-Fi based.
The only reason I bring that up is the Wi-Fi bandwidth is an issue, and that's something that Maine's slowly running out of, especially Lewiston, as the telecom isn't investing in our internet infrastructure. So something to keep in mind, because that's going to bog bandwidth down tremendously the more we add to that system.
Yeah.
I have questions for Heather. Where would you propose the 20,000 comes from? Do we have some unallocated fund balance or a project that may not have come in at budget, or?
I will get back to you. I have a couple ideas.
I'm sure you do. Councilor Ray?
Sorry, I just wanted to clarify one thing because I thought I knew what I was thinking about. The choice neighborhoods are based on the census tracts, right?
Yes.
Okay, could you
Yes.
just maybe give us a teaser on that again?
Absolutely. So the qualifying neighborhood that is our choice neighborhood as designated by HUD is Census Tracts 201, 203, and 204. However, specifically, our work is really targeted at the Tree Street neighborhood, looking at the area of Park Street to Jefferson, Ash to Maple. And our project site is the Maple Knoll development, which is on the corner of Blake and Maple. And so our target property there is the goal for redeveloping that, but as part of a larger neighborhood plan on what type of impact we can have on that broader area and not just one housing development. And so through that work, this transformation plan will focus on strategies to address that specific housing and additional housing in the neighborhood of how to improve it. Also, the neighborhood improvements and how to address challenges happening on the neighborhood physical level, and people, for the residents that are within that neighborhood, how to assist them and support them so that they can, be successful there.
Thank you for that.
Thank you very much.
All right.
And I think you're staying right there, aren't you?
Yes.
All right.
This will also be on next week's agenda.
Good evening, Mr. Mayor and councilors. Thanks for having us here tonight. My name is Catherine Elliott. I'm a development officer at Avesta Housing. I'm here with Rebecca Hatfield, who is the Director of Real Estate Development at Avesta Housing. And we're here on behalf of a project that we are working on with Community Concepts that we've talked with you folks before, and specifically with a couple of requests of the council in terms of specific things that we're looking forward to be able to move forward with this project. Before getting into kind of the building details, I'd like to invite Rebecca to just give a little bit of background and history on Avesta and context for the project that we're working on.
Good evening, Mayor Bouchard and members of the council. As Catherine mentioned, I'm Rebecca Hatfield. I'm the Director of Real Estate Development for Avesta Housing. I wanted to just give you a brief background on Avesta Housing. We are a nonprofit affordable housing provider. We were founded in 1972 when two community action agencies joined together to address the issue of affordable housing in Maine. Our mission is to strengthen communities and improve lives through promoting and providing affordable housing to people in need. And we do that through 5 areas of focus. That's advocacy, real estate development, property management, assisted living, and homeownership. We currently own about 87 properties throughout Maine and New Hampshire, and that's 2,500 units. 50% of those units are senior housing, and 50% of those units are family housing. The last thing that I wanted to note today is for this development specifically that we're proposing in Lewiston is that Avesta Housing partnered with Community Concepts on this development. So we are the developer and the property manager, and Community Concepts will be the owner of this property going forward.
A little bit of background on the site and building itself. I think this will be familiar. This hasn't really changed since the last time we talked. The 2 parcels that we have been looking at are 111 Blake Street and 82 Pine Street. There are these 2 parcels right here on the corner of Blake and Pine. This, as you can tell, is an outdated image from 2012, before those 2 buildings located on those properties burned. This is the view from above. So this Pine Street here, Blake Street here, and the building that we're proposing would be approximately this size and orientation on that parcel, on those two parcels. We do have a preliminary rendering. We're working with Platts Associates on the design. This design has changed a little bit since the last time you saw it, incorporating feedback from the session that we had with you all, also feedback from city staff and other stakeholders that we've talked with over the course of this. So a couple items to highlight here are that the building has been raised 5 steps, so about 24 inches off of ground level to provide a little bit more privacy in those first floor units, and also to be more consistent with the design of the buildings that are in that neighborhood. Part of that change then meant incorporating this accessible ramp here, so that people who need the accessibility features would be able to access the building through the main entrance. The other primary change is that we have shifted the building back in the site, so back kind of into the further corner, so that there's a setback here on both street frontages, which would be an opportunity for landscaping, trees, other greenery to both soften the effect of the building in that area and just create more interest and a more neighborhood feel. The building itself would consist of 35 units. There would be 3 stories of housing, with 1 story partially below grade that would be the location for 25 parking spots. The building would be fully elevated, so all floors would be accessible by an elevator. And there would be a number of different features within the building, a community room or community space that would be accessible by residents and also community groups, laundry facilities, secure bike storage, a trash area, and then also some general utility management office space for the ongoing management of the building. And this, which I see now that my images didn't totally transfer over. So this is a breakdown of the 35 units. The breakdown of this light blue here is 1-bedroom units. There are 15 of those, 2-bedroom units, and then 3-bedroom units. This is the ground floor, so you can see the parking spots that we're squeezing into this area here. This has not changed in any substantive way since the last time you saw plans. We would be shifting the overall footprint a little bit into this corner to get that setback, but otherwise that is mostly the same. And then this would be the first floor. So Pine Street with the main entrance here, you can see the steps and that accessible ramp would open into a secure lobby area and then a community room and restroom, so that this area here could be used for community functions. And then beyond this secure door here would be access to units. So there's a mix of 1, 2, and 3-bedroom units on each floor, with the larger units in the corners being those 3-bedroom units. And this plan translates up to the upper floors. So this would be what the 2nd and 3rd floors would look like. The only change being that instead of a community space, we have an additional unit on those upper floors. Any questions about the overall building design or plans that we can address at this point? So a little bit of information about rents and affordability. This would be, majority would be affordable housing. So 28 of the units would be what we call tax credit units, which would be restricted to households that are earning a percentage of the area median income. So 28 units would be restricted in that way, and then 7 units would be market rate. And each of those affordable units would be restricted based on the household incomes. So the 50% area median income units, the rent for those, depending on the size, would be between $600 a month or $831 a month. That's the range between 1-bedroom and 3-bedroom. And households earning between about $22,000 up to 37,000 based on their household size would be eligible for those. Likewise, for the 60% area median income units, those rents would range from about $720 to just under $1,000 a month, and the income ranges for those units would be about $27,000 through just under $45,000. And then the remaining market rents would be based on what the market rents are for the area. We have conducted a market study, so the numbers reflected here are based on what our findings were in that market study for comparable properties in the area. This is just a slightly different view of kind of what that affordability looks like in terms of the distribution between bedroom sizes. So as you can see here, the majority of those units are, the affordable units are 50% area median income units, and they are a pretty even mix of 1 and 2 bedrooms, and then 4 of the 6 3-bedroom units will be restricted to that income level. And then of the 7 60% area median income units, those are pretty evenly distributed between the 3-bedroom sizes. And the market units would be 1 and 2 bedrooms.
Quick question for the colorblind guy. Can you go back to the slide?
Oh,
'Cause
yes.
a lot of those colors are kind of the same.
Yep.
What are they again?
Okay, so the first row are the 1-bedroom units. So of the 50% area median income, we have 9 that would be 1 bedroom. We have 8 here that would be 2 bedroom, and 4 that would be 3 bedroom. And then for the 60% in units, 2 of them, these 2 here at the bottom, would be 1 bedroom. 3 of them would be 2 bedroom, and 2 of them would be 3 bedroom. And then for the market rate, 4 would be 1 bedroom, and 3 would be 2 bedroom.
Thank you.
And there's just a nice friendly little 0 there for reference. This is just a slightly different way of looking at that again, in terms of what the household incomes would be for the different bedroom sizes based on the family or household sizes. So certainly if someone had a household that was a different size than this, then they would be eligible for consideration based on what their actual household size was. So we can dig into that more later if you have specific questions, but skip over that for now. And then this is yet another way of looking at it differently, the distribution of rents across the bedroom sizes. So you can see pretty clearly here, the 1-bedroom units, those are going to range from $600 a month if it's the 50% area median income units. It would be $720 if it's the 60% units, and then $850 would be the market. And then same carrying those across the 2 and 3 bedrooms.
But there would be no market rate 3 bedrooms?
Correct. Yeah, this is just as a reference for the, yeah. So there are a couple of pieces that are still left. We are working through a couple of zoning items. I know that have been some discussions related to parking, and we're working on some contract zone details with city staff, so those items are pending. And then there's the funding question, because despite this great building that we think we're going to be able to build, it always comes down to money. The primary source of funding for this project would be tax credits, 9% tax credits through Maine Housing, which we actually got the exciting news today that we were awarded our tax credits. So that's and very exciting, because that's the most significant piece of funding for this project, and a really good indicator that we'll be able to move forward in the short term. And then beyond that, there are 3 other pieces of funding that we are seeking. One is the Federal Home Loan Bank of Boston Affordable Housing Program funding. We have an application into them that was submitted back in August, and we expect to hear from them in mid-December, which would be a source of construction period and permanent financing for the building. And then the 2 items that we're going to discuss in more detail tonight, the home funds and the TIF, which would be areas that we're looking for some involvement from the city to be able to move forward with this project. So this just runs through the breakdown of costs across the different funding sources that we are looking for. The overall development cost for this project, we are estimating to be about $7.4 million. So that includes all of the construction costs and then soft costs, land acquisition, legal fees, interest, architect, all of those different items are incorporated into that number. The primary source of funding, as you can see here, close to $5 million, is tax credits from Maine Housing. Those, as we learned today, have been awarded, so that is a significant piece of that puzzle. The second largest source of funding will be subsidy from Maine Housing, which we've requested at the maximum amount, which is determined based on the number of units that you have in your building. So that goes hand in hand with the tax credits. The next two items there, the $500,000 AHP subsidy and the $688,000 of a subsidized loan from AHP, those are pending. Those are the two items that we're waiting to hear from later this or next month. We will also have a loan, an additional loan to fill some of the gaps that we're looking at, and then the $325,000 home request that we're making of the city. So the home funds would come into the project. This is just a sample of what one of our budget tools looks like. A flow of funds that shows when different pieces of funding are coming in. So you can see here the city home funds. Oops. Oh, I guess you can't. Oh, there's my thing. Okay. City home would be, we've considered taking that in two installments over the course of construction and close out for a total of $325,000. So this just shows different points in time that we would be receiving different aspects of funding, and we can talk about that more later if you have specific questions. Yes.
Misty, how we expect those funds to be available, and where's their what are they sourced from?
Yeah. So one thing that I had discussed with Catherine before is that we would be looking for this home request to come out of next year's budget. So it wouldn't technically be available to 7/1/19, which you know, at first blush they thought that would be fine as opposed to the 5/1 that's presented here. And so that first 150 would be looking to come from next year's home funds, with the following one coming the following fiscal year. Yeah.
Thank you.
And that's a minor adjustment that just hasn't really carried over into all of our different documents, but that's something that would certainly be workable. And then the piece that we're looking at here, so when we have that $325,000 worth of home funds, these are then the dollar amounts that we discussed earlier that you can see playing out to give us this nice green 0, which tells us that we have a balanced budget. One thing to look at in here, just for the next couple of slides that we're going to go through, is both for the benefit of home funds is that it's interest-free, which means that it's easier for us to use as a permanent source because it doesn't create ongoing interest costs for us. So you can see a couple of the costs here that we're incurring on an annual basis for other loans that would be important for the project to move forward. And these numbers will go up a lot in a couple of the next slides. This is just the overall, over the course of 15 years, with that program of funds, with the home funds at the $325,000 level, and the other funds all at those same levels. We look here at this cash flow per unit, what we're making per unit, and it's great when it's green because that means it's positive. So just as an exercise, I have been playing around with because the question is always, well, how do you arrive at a number? How do you know this is the number that you need, and is there a different number? Because we want to be good stewards of funds and not ask for more than we need. So one of the pieces of this is playing around with what happens when you reduce that amount. So here, this is just one example of the different kind of processes that we've gone through. Reducing those city home funds from the 325 to the 150 means then that we have to increase the amount of debt we're carrying. So this number here, that's 28,000, in the last slide that was like this that we looked at, was just 18,000. So we've increased then our annual debt by $10,000, which for a project that runs on a budget as small as the ones that we manage makes a big difference. As you can see here, we start going negative in our cash flow by year 4. And then these numbers here aren't high enough to satisfy the other funders that we have, so the requirements for the main housing funding that we have, these numbers would not be acceptable. So if we weren't able to come up with funding that was interest-free, then we wouldn't be meeting the expectations of our other funders and wouldn't be able to proceed with the project. Are there any questions about home funds?
Councilor Marco?
There was a slide earlier that showed $12 million at the bottom right-hand corner. There was a slide earlier that said $12 million at the bottom right-hand corner. Wondering why that was in excess of $7.4 million.
$12 million.
Right there, bottom right.
This includes the construction loan. So over the course of construction, we would be drawing on a temporary construction loan, and then that construction loan has to be bought out by a permanent loan at the end of the project. So that $12 million is essentially twice the cost of the project, because you have the amount of that you've been supporting of the project costs with the construction loan, and then you have to buy out the balance that's on that construction loan.
So the total cost of construction is $12.2 million for this building for 35 units?
No, the total cost is $7.4 million. The difference is a temporary source of funding versus a permanent source of funding. So the overall cost, the number of dollars that it takes for this project to happen is $7.4 million. But those $7.4 million aren't immediately available at the outset because they're considered, they're permanent sources that fund at a certain level. And the way a construction loan would typically work is that as you progress, you request additional funds from the bank. So you are granted a cap of maybe $5 million, and in month 1 you say, well, we spent $250,000. So then the bank says, okay, great, we've reviewed everything. We agree that you have indeed spent $250,000, and they lend you that $250,000. And then the next month you spend $1 million, and you submit that same paperwork to the bank. They review, and they say, okay, great, you did spend that $1 million, and then so they give you that $1 million to pay the debts that you've accrued or the charges that you've accrued in the last month. And then at the end of that second month, you then have $1.25 million worth of money in your construction loan. But that construction loan will run out. It's time bound, so it's only that those funds are only available for a set period of time, often 12 months or 14 months. So at the end of that period, you have to pay all of that money back to the bank. And the way that you pay all of that money back to the bank is with your permanent funding sources, which would be things like that subsidized loan. The tax credits come in as a permanent source at the end of the project.
So that number is simply a hash total showing some same dollars?
Yes. Any other questions?
Continue.
All right. So the second piece is not on the permanent funding side. This is more of an operating expense approach. So the TIF funding would reduce the cost of taxes to the project, which would in turn reduce the annual cost of operating the building. One of the numbers that we look at for the success of a project is what the debt coverage is, which means how much money the property is bringing in for a period of time compared to how much money it's paying out in debt to pay loans that are due. So that number has to be positive, and that's a balancing of expenses and income. So when we are working on this aspect of the budget, we are trying to accurately estimate what our expenses will be for property management, for building costs, for maintenance contracts, taxes, and any other expenses that the building might accrue, in addition to what those loan payments are, and then comparing that to what the income is, what those rents are, to see how the expenses are handling. So we have been in the various explorations that we've done, the number that we have landed on as the most affordable for this property would be a 50% TIF for a period of 20 years. This is just a little section of one of the budgets that we've been working on that indicates that. So we have here, for those 35 units, we would have an income of $303,000 for the year. And then there are some other indicators, some other things that need to be subtracted from that. We would typically have a vacancy rate. The TIF would be counted as income, and then laundry expenses, things like that, for what our overall income there is. So you can see that carrying across. This is the same as what you saw earlier, but this $37,000 here would be directly related to what, I mean, you can see that is similar to what that TIF amount is, and that's what allows us to have this positive number here, the 408, the 372, which is required for us to secure funding from other sources. So what happens when we remove that, so this is that same slide, but just removed that 50% TIF, so we don't have that number in there, and it's very red right off the bat. So what you're seeing here is that the effect of the TIF is significant on the property's ability to maintain itself. One of the considerations for the size of this request is that this type of request is what would be necessary to make this building possible. We do run a very tight operating budget. We are very responsible stewards of the funds that we have. We have a lot of experience doing this type of work across dozens of properties in many different contexts. So we're estimating accurately what we think the expenses are going to be, and an important piece of that is, or a big piece of that is, what property taxes are. And the other piece that I would just like to put in there about the property taxes is that these two particular parcels in downtown Lewiston, they have been vacant for a number of years, and based on our early explorations, or our explorations of these properties, it's going to be really hard to develop those properties. We have done some environmental inquiries. We have found that there are some challenging soil situations there. So there are some very real costs and barriers to development that mean that it's going to be difficult to find to find positive development here. And although there are two ways of looking at TIFs. One is a reduction of taxes of income to the city in taxes, but on the flip side, it's allowing this project would still be paying $32,000 a year is our estimate in taxes, which is additional revenue to the city beyond what is currently there for those two vacant parcels, which is more in the range of $1,500 or $2,000 a year. So that is a significant part of why we think this is a reasonable request. It's a challenging site, and this type of funding would really make it possible to build this development and create homes for 35 households that otherwise wouldn't have that type of safe, affordable housing. Can I answer any questions?
I just wanted, Mr. Mayor, yeah, the TIFs are always difficult for us to deal with sometimes, but I think this is certainly a reasonable one. And often it's part of the, before you get awarded tax credits, you've got to have your deal made. And I'm a little surprised you already kind of got them. Was that subject to all this other stuff putting?
Well, it's subject to our numbers working out. We won't get that funding if we can't meet the underwriting criteria of Maine Housing. That said, I think what you're referring to is that in the application process to Maine Housing, you can get points for TIFs. If you have a TIF of a certain percentage for a certain number of years, you can get 2 points, 3 points, 4 points, and that makes you more competitive.
Right.
In this situation, we did not include any points in our application. So we are under no legal, financial, whatever type of obligation with Maine Housing to have a TIF to receive those funds. The reason we need the TIF is because it's what makes the project financials work. So in this case, there is some synergy between some of the things that Maine Housing looks for, but it is coincidental because we aren't getting points. We weren't incentivized by this particular request.
And Mr. Mayor, just a quick note to remind everybody that we do have an executive session scheduled for after the meeting where we can discuss what the council's reaction and position on the request.
And just one other question, if I may. How the affordability component that's critical here, does that like time memoriam, or is that 20 years it ceases, or whatever? Could you explain that?
It's 45 years.
Oh,
so the tax credit period is 15 years, and then we're under an extended use agreement to keep it affordable for another 30 years. Typically what happens after the 15 years of the tax credit compliance period is Avesta or Community Concepts will purchase the property and run it affordable for as long as they can, and sometimes they will re-syndicate it back into another tax credit deal, and that'll keep it affordable for much longer.
But Community Concepts will be the owner of...
They will be the owner.
Okay.
Yes.
Thank you.
Okay, thank you.
Thank you.
So I'd like to make a motion to enter into executive session pursuant to MRSA Title I, Section 4056E, to discuss a legal matter.
Second.
All in favor? Okay, let's start that at 10 past. Give everyone a few minutes to unwind, get some coffee, bathroom. Probably ought to wait for the light. All right. Mr. Barrett.
Okay, the requested motion is as follows. The motion is to approve with conditions the license application for Jason Grover for a medical marijuana primary caregiver license, subject to conditions in accordance with the Code of Ordinances, Sections 22-35B3 and 2235C, based on a determination that Mr. Grover's criminal history, including a conviction on August 6, 2009 for the Class C felony of operating under the influence, is rationally related to the regulation of the medical marijuana primary caregiver business, and based on a further determination that concerns regarding Mr. Grover's criminal history can be ameliorated by imposing the following conditions. 1, Mr. Grover shall be required to notify the city clerk within 5 days of the date that he is charged, indicted, or convicted of any Class A, Class B, or Class C crime, or any crime committed under the laws of the United States of America or any other state or territory thereof, that is punishable by a sentence at least as harsh as that which is authorized for commission of a Class C crime under Maine law. And 2, Mr. Grover will not operate a medical marijuana storefront operation.
So moved.
Need a second.
Second.
Motion by Councilor Lyson, seconded by Councilor Joy. Do we need to beat this up anymore? Anyone? Call the roll.
Counselor from Ward 1.
Yes.
Ward 2.
No.
Ward 3.
No.
Ward 4.
Yes.
Ward 6.
Yes.
Ward 7.
No.
Mr. Mayor.
Yes.
Motion passes 5-2.
4-3.
4-3.
4-3, excuse me.
Other.
Sorry.
Okay, Councilor Lyson.
Yes.
We now need another motion.
yes.
Sorry.
Yes, we need a motion to go into executive session to talk about a real estate matter.
Sounds good.
Second.
All in favor?